Hello, everyone. Welcome to some more tips on how to practice nursing in the United States. I'm Adam Kless. I'm Vice President of Clinical Operations for Avant. And with me is Erica DeMoss, who is the manager of the Clinical Transitions Program that you will be attending here in Orlando, Florida. So today, our tip for you is about technology. One of the biggest practice differences that we see for our nurses that come from around the world to the United States is the level of technology we have in the United States. So our hospitals, very high tech, lots of protocols, lots of rules, lots of regulations. So we leverage technology to keep our patients safe. And you'll see behind us, we have some examples of the technology, the computerized documentation. We have IV pumps and a patient-controlled analgesia pump. We have blood pressure and temperature monitoring that is electronic. And that's just the tip of the iceberg with the technology you'll find. Some hospitals are super sophisticated and they'll have patient tracking systems. And they'll have wearable technology. There are things that you may have to wear on yourself so that your patient knows where you are and how to get you. So lots of really cool stuff here in the United States, but sometimes it trips you up. And if you're not used to using it, you don't know how to use it properly and you can make some mistakes. So when you come to Clinical Transitions and you're with Erica and her team of educators, we're gonna give you exposure to all of this equipment. We're gonna let you practice on the IV pumps. We're gonna actually let you make mistakes and see what it's like to make a mistake in a safe and controlled environment. And just because you don't have access to the technology today where you're at, there are things that you can do to practice. And one of the biggest challenges for our nurses with technology is this computer back here, charting at the bedside. So we don't expect you in the US to go see your patient and try to remember everything back at the nurse's station and write it down. We expect you to navigate through the electronic medical record while the patient is here, while you're talking to your patient in real time. And that's a huge practice change. So Erica, how in the world are we going to prepare them to do this?
So my number one piece of advice to you is if you have the ability to practice your typing, if you're a hunt and peck typer, that's okay. Because you can hunt and peck really fast, trust me, that's me. But practicing your typing is going to be one of the best things that you can do because charting is time intensive. And the faster you can type and the higher accuracy, the better. There's nothing wrong if you type it like this, if you can do it quickly and accurately. But I definitely recommend practicing typing. And if you're not familiar with various electronic documentation systems, go look some up on the internet. Do an internet search for electronic documentation. There are multiple ones out there. And there's a lot of videos that can give you kind of let you at least kind of see, get a feel for, how people navigate them, just so you can, kind of know what to expect and be a little more comfortable with it.
I know that there's a lot on YouTube, right?
Mm-hmm.
I mean, YouTube has all sorts of stuff in it, but
you never know what you'll find.
But there's good stuff on YouTube that you can look up right now. So Erica, if you're going to go to YouTube and look things up, what are the major electronic medical records that we see our hospitals using that they can focus on?
Okay, so a big one is Epic. That's EPIC. Unfortunately, that's also the hardest one to find stuff on because they are very proprietary about their information. If they find stuff online, they pull it down pretty quick. But occasionally you can find some videos and stuff on it. Cerner, there's a lot of information out there on Cerner, and that's CERNER. There's also a fair number of hospitals that use Meditech. Probably one of the more, I won't say difficult, but sometimes one of the more challenging.
It's a challenging one. I used it.
I
you
have
used
too.
it, yes.
There's a lot of information out there on those as well. And there's some other EMRs. MedHost comes to mind, but probably Meditech, Cerner, and Epic are going to be the big three.
Yeah, good. That's helpful. So if all electronic medical records kind of work in a similar fashion, it kind of doesn't matter what the platform is, if it's Cerner, Epic, even McKesson, they are laid out in a similar fashion where you are going through tabs and you're clicking and you're navigating. So when you think about being at the bedside here, working with your patient, doing a head-to-toe assessment, you're going to be in an assessment screen and you're going to click through body systems as you go through. It's of critical importance that you get comfortable working with the computer and engaging your patient at the same time. So, Erica, are there typing resources out there that are easily accessible?
Yeah, one of the ones that we actually recommend to a lot of our nurses for practice is typing.com. And our nurses have been really successful with that. And we've seen huge increases in their proficiency, their accuracy, just from doing the regular practice with that one.
That's great. That's great. So this is another tip for you today on how to be successful. And just the theme here is there's things you can do now that will prepare you to come and put your hands on this equipment. So go out there, use the internet, search, look for videos. Erica gave you some great tips on the types of electronic medical records that are out there. And that is probably the biggest challenge that you're going to find on technology. We'll teach you how to work pumps. We'll teach you how to work other monitoring machines, but you and you alone are going to be responsible for making yourself successful navigating an electronic medical record. So I hope this helped, and I hope you found it interesting, and I hope it's made you even more excited to come to the US and work with us here at Avant. So until next time, thank you for joining us, and we'll have more tips to come.